The disease that shocked me the most when I was a trainee in cardiology, I was a cardiology fellow, was cardiovascular syphilis. I was like, what is that? So we had a 49-year-old patient coming in heart failure. Okay, so what caused this heart failure when we did an echocardiogram, which is an ultrasound for the heart, was his aortic valve, which was, the aortic valve is a valve that controls blood flowing into the aorta, and the aorta is the biggest artery in the body. It takes blood outside the heart into the body, to the brain, kidney, and whatnot. So his aortic valve was destroyed, so blood was leaking. And then, we went ahead to evaluate why a young man like this had his aortic valve destroyed. So we took him to the catheterization lab. So usually you want to see how those arteries in the heart are, because you're evaluating for the cause of heart failure and the cause of this destroyed valve. And it's actually, if you're going to replace a valve, they will want you to look at the coronary artery, so that if you're opening someone's chest, you want to fix everything that's wrong with that heart. So if you're going to do bypass, and bypass means you're putting in new arteries to bypass the blocked ones, then you want to evaluate, so that if you're opening someone's chest, you fix everything, yeah? You don't come out and then now you have to go back in. So part of the evaluation for heart failure and this destroyed valve was to do the assessment. So we tried to put the catheter in and we weren't able. All the arteries on both sides were severely narrowed. So we had to take him to do a CT scan instead. A CT scan to look at those tiny arteries of the heart, it's called CT coronary angiogram. And it confirmed that, those arteries around the aorta, actually the aorta, the aortic valve, the aorta, and those arteries were all inflamed in what is called vasculitis, inflamed arteries. So there are a few causes. And so we went back to talk to this patient to ask him if he's had any infections like syphilis before. And so we tested him for syphilis and it was positive. The titers was so high. So this patient wasn't even aware that he had syphilis. So anyway, these are some infections, okay, that don't just affect, the other organs. I don't want to call it the real word, but the word is SEXUALLY, transmitted diseases that are important to the heart. We've talked about syphilis. Now, syphilis is so innocent, and it's pretty much symptomatic for many patients. So it just goes quiet from the primary infection. It goes quiet. You think that you're okay until 10 to 30 years later from the initial infection with syphilis. We all know how syphilis is transmitted. So 10 to 30 years, it starts to affect your big organs. The heart is the first one to be affected, in the manner that I have described. Aortic valve and the aorta, aortitis, inflammation of the aorta, of the aortic valve, and the arteries around it. So it causes leakage, and then you go into heart failure. And, mortality is chances of not making it are very high. Your heart can just stop if you have this crazy inflammation. The other syphilis also goes to the brain 10 to 30 years later, and then it causes what is called neurosyphilis. So neurosyphilis, it's like a patient is psychotic, there's dementia, they get a stroke, they are like paralyzed and they can't walk. And then the eyes don't see well. So neurosyphilis, also mortality rate is high, just like cardiovascular syphilis. So when we create awareness about, these transmitted diseases, hii magonjwa ya zinaa, It's not just that, it doesn't just cause infertility and blocked fallopian tubes and lead to urethral stenosis, and later on you're not able to pee because your urethra is kinked. But it could also affect your heart, and it can affect your brain. The other STD, which is important to pay attention to, is of course HIV. HIV can lead to cardiac disease. It can lead to what is called pulmonary hypertension, meaning there's a lot of pressure on the right side of the heart, and also that increases mortality, or it can cause inflammation of your heart in what is called myocarditis, and you can go into heart failure. Pia, the medicines that we use for HIV to suppress the virus, these medicines can lead to what is called metabolic syndrome. You can start to gain weight, and then your cholesterol levels go up. You can get the diabetes, from these medicines. And then after that, you can acquire, cardiac disease. So prevention of all these things is important. So for pregnant women, it's important to go for antenatal clinic so that, we test so that you don't transmit it to the baby. And also, how are you going about your business? You need to protect yourself, not for the sake of your heart and your brain. These things can lead to heart and brain. And, health is wealth. If you're not healthy, you won't even be able to, to go about life and to make money. So protect yourself, Kenyans. The syphilis rates, syphilis is still there. It's not an old disease of CG 1950. Syphilis is there. People have it. And HIV is still being transmitted. And the 99% way of transmitting HIV, you guys need to protect yourself. Okay, I know many, especially, I usually hear, the young Kenyans who never lived through the AIDS pandemic. I mean, I was a youth when people were just, dying, and there were no ARVs. People were just, they weren't living long. They were just dropping. And so that is very scary, and it scarred most of us. But the younger people who never lived through AIDS pandemic are the ones who can talk and say, mi siogopi kitu bana, kuna madawa. I mean, if you pick one infection, you might pick very many others, and the consequences are there. You will live through the consequences. Don't lie to yourself. When you're cornered alone with a disease, you're the only one who will be going through the consequences. Your hype mates won't be there. Your drinking mates won't be there. The guys you're messing around with won't be there. So nawaomba tu kwa unyenyekevu, protect yourselves. Do what you can. Don't be careless and say, na nikigongwa na gari ukigongwa na gari, you won't even know you've been. Ukigongwa na gari na utoke hii dunia, hata hautajua uligongwa na ukakufa. But sasa ukipata hizi magonjwa zingine yani looking back, utaanza kuregret sababu ni kitu ungeweza kuzoea, because the consequences are there. Consequences are there. So beware.